So, Mr. Minister, greetings to you. I've heard a lot about the preceding roundtable. What would you do if the minister? Well, that's really good because here we have our minister here. So we're going to be asking you some questions. You have a broad mandate because you take care of elderly people, young children, people with disabilities, and also with family associations, the battle against poverty, minimum social incomes. So you have such a broad mandate. So it's really the most fragile one. You address a fragile situation of citizens. How would you really present it as a ministry of all the different vulnerabilities? Yes, from the young childhood, going through disabilities, a situation of precarity, the elderly person. So what I, as a minister, I want to change the way we look at these vulnerabilities. We think of them as something very negative. And rather than presenting, I think we could present them as really a wealth for our society. So your asset is that you are not adapted to different things because you are the general director of the Red Cross in France. But also, your weakness is you're not really a politician. But the risk is if you have all these different administrations of your ministry, there are many, they're very powerful, these ministries. So I'm thinking, I heard one of the members of the DG of Health saying, there's different governments and we stay here. So in other words, so we do what we want. Things are not always changing. What can we do to make things different? So what do you plan to do so that you can actually make changes quickly with this interaction with the different ministries? So if we look at the political aspect, when we have a government and when we come from civil society, the subject is how can we ensure that these subjects, these concerns, are really at the top of all the different political priorities of the government. So in other words, it's a collective approach with the other ministers that one has to really take this battle up. So you, the administration, is perhaps not exactly completely accurate. Well, in fact, I've known different administrations. However, in fact, now for 3 months, I've been in office and I saw the director here. So I work with the different social cohesion DG, and I work with this team that I've seen members here. And so I've been spending half a day yesterday with them, and they are already working on the roadmap and without any difficulties. Now, of course, I came from civil society, but I was really the head of this of a company, and so I also have I've been in the function of being a manager. So this experience that I acquired during my 11 years at the Red Cross in France was very useful in my ministerial functions. Yes. So now the first theme is solidarity. Is one of the major commitments of the president during the campaign was to really have a new situation for the aids. So a citizen would be actually asking for an aid, and then he would be actually given one or not. And 30% of these aids were not actually granted. So what are you going to how are you going to change? You've announced that there will be an experimentation for the minimum income in 2023. Can you explain to us how this will happen, this process? Yes, the idea, and I would like to specify that we are not going to really remove all and eliminate all these assistance packages. But what we're going to do is we're going to address them. We're going to go towards the person saying, because of your profile, that we've been able to determine your income, for example, you have this ABC assistance. So would you like to have recourse to this? Is what we call solidarity at the source. And this is a major project which we aim at really changing our social benefits. So we have 15 different social benefits that are not really very well connected together, and they do create a system that is not transparent. And so, as you said, 30% of the person that should be entitled to this minimum income help do not have it. And there also is a problem with fraud. And so this is why there is defiance in the system. We have to fight against it. And in my capacity as minister, we want to have this tool to really steer this public policy. Now, when concretely will we have the first effects from this experimentation? As you said, as of 2023, in 10 territories in France, we'll have this pilot program. This will be against this non-recourse. We want to understand the mechanisms of isolation so that our country, certain number of persons do not have access to these assistance that they are entitled to. This will be the Zero No Unemployment Territory program, and we'll be working with administrations concerning the solidarity at the source program in the first phase, which is one of the pre-filling of these different questionnaires to have aid, and then to have mechanisms to going in this direction. So you have a plan against poverty, which will be actually coming up. So in parallel, we do have this strategy of fight against poverty, which is be terminating at 2022. So we'll be working towards renewal. And in my roadmap, the First Minister has asked me, the Prime Minister has asked me to really create a new solidarity pact between the state and the different communities or collectivities in France and the associations. There's different lessons we have learned from this strategy. There are different strong convictions. First of all, we do need in this country, if we want to combat poverty, we need to have a strategy which is shared, which is transversal, and which has a long-term approach. That's the first lesson. The second lesson drawn is to capitalize on what was done well in the preceding strategy. Not everything was done completely flawlessly, but we want to look at what was done well, and then to fight against poverty really at the roots, the different inequalities from the destiny. Invest in the young childhood days, and to really complete with everything that is missing. This is going back to my Red Cross experience. If we want to do something about poverty, we have to really aim at the major poverty problems. And this, in fact, was actually indicated in different reports. And this is another point that I'm working, which is the ecological transition, which also needs to have a solidarity background. We can't leave behind the most precarious families in our country. When we talk about energy precarity, for example, we can also talk about the cost of energy when we live in these thermal issues. But it's different when we are in households that can heat, because they have the money to do that. So to do this, to combat poverty, we want to really work on this energy transitions. There are different factors. There are different factors connected to costs for households, mobility, etc., and those are really essential. Now, in your report, the direction of research and studies and evaluation, so we look at these statistics that 10% of the poorest ones, there's more risk of developing diabetes than rather as compared to the richer population. And with also the workers, in fact, have more of a chance of becoming obese compared to executives. So really, you are completely right. There's inequalities that are enormous in the area of health. So they have the opportunity for these children that are in precarity. Their opportunities are not the same as those that are wealthier, come from wealthier families. We yesterday and this morning we were together at Aubervilliers in a healthcare center, which is called a participative one, to work on these kinds of issues. How do we work on prevention with these families in a precarious situation? There's a medical demographics situation where you don't have many doctors there. For example, these are populations which are not used to working on their health. They don't have a good grasp on the health area. So we want to have a different installation in that area. For example, rural areas, we want to have more presence there. We want to go towards these populations. We want to invest in the health prevention programs. We want to also have a major program against obesity. 70% of the children are overweight. And so we know that this is a serious problem, and this will maybe make you laugh. In my roadmap, but I'm working on elderly people as well. And so I have the custom say, aging well, it starts at childhood. And when we work on prevention in the health area, we need to invest in the early childhood age. And so we're going to talk about early childhood age. Another commitment in the presidency was to open up some 2,000 centers for these toddlers from infant stage. as well. This is a real challenge. When we look at these issues that are being raised, attractivity of these professions, this is a red line, we can say. In fact, there was a study which showed that in the different nurseries, there were 10,000 different professionals which were missing. We didn't have all of this personnel necessary, and so it's important to work on the attractivity of professions for the early childhood centers. And we need to set up a system which will have more of an incentive to create different jobs at different areas of the country. So why not think about obligatory competence for the communal area to develop nurseries in the territories? And as of this year, in our social security possibility, we started adding the first brick for this. First, we're starting up this program, which wants to reform this special child situation, so that children will be taken care of and it won't be that expensive. So, a nursery, a place in a nursery school is not as expensive as it does not have the same cost as a babysitter. And so many modest families cannot have a babysitter. And so what we want to do is thanks to this reform of this child care, we want to make sure that the cost will be the same to have a child in nursery school compared to a babysitter. And this is another point. I take advantage of saying this now for this opportunity before me. We've invested a lot concerning this single household. 90% are women. They are living under the poverty threshold. And so when we fight against poverty, what we want to do is to really increase the child care for these single households for the children that have children that are 6 to 10 years. We will have child care facilities for them so that the mothers can work. And we're going to increase also this minimal food allowance benefit for these mothers. And we'll start this as of November of this year. So this is a measure which we are doing so that this is to enable us to really reduce by 2 points the households of single parents. So this is the important reform that we've been announced, that has not yet been voted, but we're waiting for the different actors in the fields, and our citizens are waiting really to do something about this. Nothing will move for some months because you yourself have launched this citizen forums. No, do you think we're going to have people will be disappointed because things are not happening quick enough? Well, no. I really want things to go smoothly. We have to go quick, you're saying. Yes, there are two pressing matters to really age well. We have the crisis that the sector knows. We have this urgent situation connected, of course, to the recruitment, attractivity of jobs, also to the impact of inflation, energy issues, and prices. So this is why we have this project to really help all of the different operators in the medical social fields, in the nursing homes, and also the home care for elderly people. And also we want to help with the situation of the demographic transition. And this is really a long-term approach. There will be the transformation of the different offers. You have modernization of nurseries, nursing homes. We have to have trust in the system. There are measures that we have already started. We'll have others. We'll continue also. The President of the Republic has wanted to have this good aging to be part of this Council of Foundation. We want to have this medical social dialogue that we pursue. Aging well is really the issue, which the place we give and the space we give to older people. And this is there's also vulnerability when they lose autonomy. So this is for the older person. So this is why we need a public debate so we can involve our citizens much more than we've done in the past. The idea is not to really reinvent the wheel, no, and redo what we did things in the past. And there's members of parliament that were very much committed in this area. We know what we need to do, more. We need to converge. We have to have a plan, a schedule. We need a vision for society. so that we can really conclude this phase, which is why right now we're in the discussion stage. Now, we will need maybe then legislative measures. So, okay, then we will have legislative measures. It can be different proposals for different acts. We will have different regulations as needed. And so this is a very important. This demographic transition really requires us to have a really special societal program, to have this moment of reflection. And just to tell you that we'll be working on 3 main priorities. It's not exclusive, though. Prevention of loss of autonomy to age well, the question of citizenship and social, for example, how they can be autonomous, how can they really participate in as a citizen. Contrary to the disability sector, the aging sector is really not very well organized. So we want to have older people speaking, people concerned. It's very complicated to do this. And the last one is the professions. This is really the key to everything. Even if we've done a lot in the past, really, professions being attractivity is important. You talk about aging well, but now, when we were talking about the nursing homes, they've been multiplied by 3, and so what are we going to do? How can you help to have this area? Because, in fact, there's 2 points I'd like to mention in this regard. The first one is concerning the issue of the different control and inspections in these medical social centers. We've given them the resources to actually recruit, to do these inspections and controls, and we will keep this promise to have these control inspections in these 7,000 different nursing homes in the 2 years to come. Things are organized, and there is no problem. Of course, it's a heavy schedule. Yes, we're working hard. Yes, we are. We're mobilizing our agents and they need to recruit the 120 persons who will be dedicated to this subject to do it. It's absolutely necessary. And then again, it's important to mention that we are continuing this dynamic situation because we have these new powers. So we have new controls that we can control the nursing home. So we're continuing the PLFSS. And so we're also going to be retrieving the public funding, which were not used in an efficient way. This is one of the areas. There'll be others as well. And there's the question of the abuse and those people that are not treated well. This is good news that we are having much more people talking about this. People are really opening up and talking about this. We have different pipelines open up so that we can know about if there's an abuse in treatment. We need to treat better in these nursing homes, and this is why I have really contacted IGAS, which is public health, and also this National Conference of Health to work on this problem, so we can produce, by the end of the year, a major strategy concerning this poor treatment and abuse in treatment. This will answer the question, which is crucial. Yes, I would like to say something about you were talking these poor these helps assistance. You said you actually what do you plan to set up so that you can have these people that are the aides, assistants that are working, that they would have better recognition. So you're right. It's really important that we help people that are caregivers. We all were confronted in our life of this kind of situation. We or someone in our family. And so we have 9 million, some 40% that say it's really difficult to reconcile their professional life with this role of being a caregiver. So these are women that don't have much money. Yes, there's a societal challenge, which is major. So we have a strategy. We have this special subsidy that's been located to help people that are helping someone in their family. And now we have to have other measures to have this recognition for these caregivers. There was also this question of this, to recognize this experiential know-how of these people that are caregivers so that their experience will be recognized by those that they're helping, but also we need to invest in this issue in general. We're talking about these people with disability, so there really was a really was a burden in this area. We were announcing that we're going to actually really do much more, but all this will take a lot of time. And why will this all take a lot of time? Well, in fact, it was voted in July, and this really was a big progress that we've made, and I want to, for the dignity of persons. It takes time for two reasons. Well, the first reason is this, to combine in this situation, is to have separate, you'll be the people that will be losing. Some 40 million. So people that they'll be, so those who will win and those who will lose. And so we have to find a system that will be fair and that will really legal, that will enable us to really correct those who are losing. These are families that are the most modest ones that are losing. So it's not a measure that was not a very sociable one, did not have a good social benefit. And so it takes time. It's very complicated for the national allocation section to make a major transformation. We go from this family system. All of our social benefits were based on the family. Now we're getting out of this allocation, and so it's separated. So we need a transformation for the different IT system for the organization, which is very tedious. So we said October 2023 is our deadline. If we can do it before, we will do it. I'm committed to actually come up with a decree very quickly. It will be done in December, but already the CNAP is working to advance on this separation. Now, the accessibility, we're really lagging behind. It's a scandal concerning access compared to the northern countries. What can we do? We've been talking about this for years, and nothing's happening. Well, okay, we can't do everything right away for the first law. Now, this law goes to 2005, but we still are lagging behind, I agree. Now, we announced with the Prime Minister a national consultative meeting for those people with disabilities. We're going to be accelerating in the universal element. What we need is steering by the territories and for the implementation of these obligations to have better access. We have organized at the level of the state. We have a reference contact person for the disability. We want to, in each territory, we want to do this actually we have it nationally, and I want to do it in the territories. And we want to really revise our agendas that are scheduled, that they also are lagging behind. So we have this political will, and now we have the steering that is lacking, but we need to accelerate. I do believe that the question of this aging well society program, this will make the society where, for example, the public space will be more inclusive for people that also, the same for people that have disabilities, but also people that lose their autonomy will have more space and more recognition. So so you're talking about attractivity of professions. This is very important for you, I know. And so we really don't have enough professional staff in this area. How can you explain this? We were saying that why the healthcare area is lacking so many professionals. Well, this is a factor that makes it such a complex subject. So you have, the salaries we've been paying during the COVID health situation. We saw there that there was a real problem between the impact of these professions and their compensation. So we started catching up. We're catching up, but that's not enough, I know, and for their income. There's another subject which is important for the organization of the professions themselves, which do not correspond to the aspirations of the young people. There's a lot of constraints with these professions. And so it's hard to reconcile professional and private life, as the young people nowadays want to have a good reconciliation between them, good balance. And there's also lots of things concerning the quality of the work life, conditions of work. All of these kinds of subjects have to be addressed. And we have to do this in a completely transversal way. And you were talking about meaning. We have to talk positively about these professions rather than badly. As I just said, I say it's really hard, there's lots of constraints, we think horrible things. We can't talk like that. When you talk about also abuse in the nursing homes and in the nursery schools, now our society needs to talk better about these professions. They have impact, they have meaning, and they can respond to aspirations of our young generation and for our society. But that's not enough. We need to act at the same time in the area of all the different factors which relate to attractiveness of a profession. Now, you have different ministers. There are different ministers that overlap with your ministry. François Brun is in charge of prevention, and Agnès that we were talking about, who also Agnès Firmin-Lebaudot was Minister of State for Territorial Organization, Health Prevention. Now, all these different breakdown of these different skills, how do you all work together? Now, really, how do things happen? Don't just say you all work well together. Who does what? Who does what? Okay, so we have François Brun, who handles prevention in the health area in the delegate, Agnès Firmin-Lebaudot, and also Minister of State for Territorial Organization, and I am there for solidarities of independent persons with disabilities. We have a person in charge of disabilities. I think it's very good. I can't say the contrary. To have this in this area, to have this, it's really interesting to have our different ministries. And so before when they were regrouped, we didn't talk about solidarity in the past when we had the regrouping of these two ministries. But I think it's very important that we work together. That's necessary. We, both of us, have been working on the reform of our respective administrations. This is our mandate, and so we are in charge of the regional health area. So we need to set up mechanisms that will not just so obvious to do, but we need to work together very well, and both are connected. Just the connection between health and societal issues are connected. One goes with the other, and also with aging well. I'm not going to be working alone, just in the area of prevention. When François Brun in the CNR Santé and Health will also be working in the area of prevention. Now, just to conclude, I would like a short answer. What is your precise commitment that you can take for 1 year? So when we see you next year, we're going to see if this commitment was respected. This is not easy. Okay, now we want to see what will really have changed by next year when we see you next year. The attractivity of professions, it won't change in 1 year. No, but maybe not exactly in 1 year, but really that's a priority. In any way, without that, I won't be able to manage anything. I won't be able to be successful. I can do all the public changes that I want. If I don't have the commitment of men and women to do this, then this is pointless. So that's my first priority. And so I think we'll be able to have a different situation than we have in the future. Thank you so much. We hope this as well.